In my role as beauty director, I've become very knowledgeable about a lot of products, and so people are asking me about them all the time. My friends ask me at lunch, my coworkers corner me in the ladies' room, mommies ask me on play dates, and one of the things they ask me most often about is Botox Cosmetic. I get asked all kinds of questions about Botox Cosmetic.
Is it gonna look fake? Does it hurt?
Am I ready for Botox Cosmetic?
The best person to answer your questions about Botox Cosmetic is a doctor. So here we are at my doctor's office, Dr. Doris Day, and we're going to get your questions answered. Oh, Dr. Day, it is so good to see you. Can you believe that it has been 12 years since I came to see you for my first Botox Cosmetic treatment to treat those bad lines between my brows?
Where's the time gone?
I can't even imagine. I've been doing Botox Cosmetic treatments all along, but now, of course, the lines are back, they come back. But I also wanted to talk to you about treating my crow's feet. They've been getting a lot more noticeable lately.
Botox Cosmetic is the only FDA-approved treatment for the lateral canthal lines that are moderate to severe, and we know those as crow's feet lines, and they can become deeper over time. You're a perfect candidate for the treatment.
So in addition to my treatment, I have so many questions from my readers about Botox Cosmetic that I want to ask you because you're the expert.
After Botox Cosmetic, is it still possible for me to make expressions?
That's a great question, and the short answer is yes. In my experience, Botox Cosmetic is very precise and predictable, and when administered properly, it really does soften the lines between your eyes, allowing you to be expressive, but still look like yourself.
How do I find a good injector?
Botox Cosmetic is a technique-sensitive treatment, and it's so important to find a trained aesthetic physician who understands facial anatomy.
I totally agree. I get asked this question a lot, and what I always tell people is the more experienced the injector, the better.
Is it only for celebrities and socialites?
I think that's probably one of the biggest misconceptions about Botox Cosmetic. In my office, I see everybody from the secretary to the CEO on a daily basis. Any more questions from your readers before we start?
Am I ready for Botox Cosmetic?
I get that question in my practice every day. Patients coming in and asking if it's the right time for them to have a Botox Cosmetic treatment. And the way that I tell my patients is that you'll know when you're ready. You'll notice the lines getting deeper and it starts to bother you more.
Honestly, is it worth it?
I think I'm gonna take this one.
Okay.
For me, absolutely. You know, it doesn't take a lot of time, it costs a lot less than I thought it would, and I only have to come to your office a few times a year to treat these frown lines.
Absolutely true, I get that. All right, so let's start. You ready?
I'm ready.
Okay. So just relax, it's a little pinch. Common side effects include localized pain, infection, inflammation, tenderness, swelling, redness, bleeding, and bruising. All right, we're all done. You did great. In my experience, you may start to see results in a few days, and you'll have optimal results in about 30 days.
Botox Cosmetic, onabotulinum toxin A, important information. Approved uses. Botox Cosmetic is a prescription medicine that is injected into muscles and used to temporarily improve the look of both moderate to severe crow's feet lines and frown lines between the eyebrows in adults. Important safety information. Botox Cosmetic may cause serious side effects that can be life-threatening. Call your doctor or get medical help right away if you have any of these problems anytime, hours to weeks after injection of Botox Cosmetic. Problems swallowing, speaking, or breathing due to weakening of associated muscles can be severe and result in loss of life. You are at the highest risk if these problems are pre-existing before injection. Swallowing problems may last for several months. Spread of toxin effects. The effect of botulinum toxin may affect areas away from the injection site and cause serious symptoms, including loss of strength and all-over muscle weakness, double vision, blurred vision, and drooping eyelids, hoarseness or change or loss of voice, trouble saying words clearly, loss of bladder control, trouble breathing, trouble swallowing. If this happens, do not drive a car, operate machinery, or do other dangerous activities. The dose of Botox Cosmetic is not the same as or comparable to any other botulinum toxin product. There has not been a confirmed serious case of spread of toxin effect when Botox Cosmetic has been used at the recommended dose to treat frown lines, crow's feet lines, or both at the same time. Serious and/or immediate allergic reactions have been reported. They include itching, rash, red itchy welts, wheezing, asthma symptoms, or dizziness or feeling faint. Tell your doctor or get medical help right away if you are wheezing or have asthma symptoms, or if you become dizzy or faint. Do not take Botox Cosmetic if you are allergic to any of the ingredients in Botox Cosmetic. See medication guide for ingredients. Had an allergic reaction to any other botulinum toxin product, such as Myoblock, Rimabotulinum toxin B, Dysport, Abobotulinum toxin A, or Xeomin, Incobotulinum toxin A, have a skin infection at the planned injection site. Tell your doctor about all your muscle or nerve conditions, such as amyotrophic lateral sclerosis, ALS, or Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome, as you may be at increased risk of serious side effects, including difficulty swallowing and difficulty breathing from typical doses of Botox Cosmetic. Tell your doctor about all your medical conditions, including plans to have surgery, had surgery on your face, weakness of forehead muscles, such as trouble raising your eyebrows, drooping eyelids, any other abnormal facial change, are pregnant or plan to become pregnant. It is not known if Botox Cosmetic can harm your unborn baby, are breastfeeding or plan to breastfeed. It is not known if Botox Cosmetic passes into breast milk. Tell your doctor about all the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal products. Using Botox Cosmetic with certain other medicines may cause serious side effects. Do not start any new medicines until you have told your doctor that you have received Botox Cosmetic in the past. Especially tell your doctor if you have received any other botulinum toxin product in the last 4 months, have received injections of botulinum toxin such as Myoblock, Dysport, or Xeomin in the past. Be sure your doctor knows exactly which product you received. Have recently received an antibiotic by injection, take muscle relaxants, take an allergy or cold medicine, take a sleep medicine, take aspirin-like products or blood thinners. Other side effects of Botox Cosmetic include dry mouth, discomfort or pain at the injection site, tiredness, headache, neck pain, and eye problems, double vision, blurred vision, decreased eyesight, drooping eyelids, swelling of your eyelids, and dry eyes. For more information, refer to the medication guide or talk with your doctor. To report a side effect, please call Allergan at 1-800-433-8871. Please see Botox Cosmetic full product information, including boxed warning and medication guide, on this website.